Hi everyone, welcome to my another video. So this video is gonna be about the arrhythmias. As we have learned the ECGs in the last video, so in this video we are gonna talk about the arrhythmias. Arrhythmia is basically means the abnormal ECGs. So we are gonna start off with how to identify sinus rhythm. So we are gonna first see sinus rhythm. So as all of you know that in ECG there will be P, then Q, R, S and then T. This rhythm is our correct ECG rhythm. So this rhythm, if it is occurring in the same time duration, like it is happening every 4 big boxes, or it is happening every 3 big boxes. So we can say that this is the sinus rhythm. And in sinus rhythm we also have to look for the P wave. In sinus rhythm there should be always P wave present. If it is not there, then it is not sinus rhythm. So if P wave is not there, then what can we call it? If P wave is not there, then we can call it irregular rhythm. If it is not there, then we can call it irregular rhythm. Okay, so in sinus rhythm first we have to look for the P wave and then we have to look for the time duration. We have to see the impulse is going in the same time duration or not. So move forward to another arrhythmia, which is atrial fibrillation and atrial flutter. Second is atrial fibrillation / flutter. So one thing in atrial fibrillation you have to remember is irregular rhythm. How do you identify irregular rhythm? So irregularly means there is no P waves. Okay, there is no P waves. And irregular means if it is not occurring in the same time duration. Sometimes it is taking 3 boxes to generate QRS impulse. Sometimes it is taking 2 boxes to generate 2 QRS impulse. Sometimes it is taking one box to generate QRS impulse. So this is irregular rhythm in which you will have no P wave and you will have no same time duration, which is called atrial fibrillation. And if you see the ECG, it will look like this. So it is going this, and then QRS, this, QRS. Okay. This is our typical atrial fibrillation. See, there is no same time duration. This is longer, this is shorter, then this is longer, then this is shorter, and there is you cannot identify the P wave here. So this is atrial fibrillation. So moving forward to atrial flutter. If you have seen shark, you will see the shark fin that is above the sea surface. That is how our atrial flutter looks like. So shark fin, then QRS wave, shark fin, QRS wave, shark fin. This is how our atrial flutter looks like. So this is so much different than atrial fibrillation, because in atrial fibrillation you will have irregular rhythm, but in atrial flutter you will have regular rhythm. But you cannot identify P waves. That's why it is just irregular rhythm. So irregularly regular rhythm is our flutter, and irregularly irregular rhythm is our fibrillation. So we have seen irregularly regular and irregularly irregular rhythm in which you will have no P wave. What if this P wave is present? Then we can say that we are having supravetricular tachycardia. But you cannot identify P waves in supravetricular tachycardia rhythm too, because it is diminished in the ventricular tachycardia. You have to have so much experience to see these P waves in supraventricular tachycardia. So moving forward to another way to identify arrhythmia, which is QRS complex. You have to see whether the QRS complex is narrow or QRS complex is wider. Like I have told you in the previous video that normal QRS complex is less than 3 small boxes. If it is more than 3 small boxes, then it is wide QRS complex, and if it is more less than 2, if it is less than 2, then that is narrow QRS complex. But we are not bothered about narrow QRS complex as much as we are bothered about the wide one, because wide will show the bundle branch blocks. Wide will show us what? Bundle branch blocks, BBB. Wide will show us bundle branch block, but we are not bothered about less than 2 because it is kind of normal. So next way we are going to identify the arrhythmia is looking at intervals. Looking at intervals. So what intervals we should look at? So we should look at PR interval and QT interval. Okay. So all of you guys know that our ECG look like this. This is our P wave, then Q, R, S, and our T wave. So from P, this is our P to R. This is our R. This is our P R interval. Okay. So this PR interval can be shortened or can be wider. So normal PR interval range is 120 to 200 millisecond. If it is more than 200 millisecond, then it is wider, then it is prolonged PR interval. If it is less than 120, then it is short PR interval. So you can say that this is more than 200 millisecond. You have to see 5 small boxes. If it is more than 5 small boxes, then it is prolonged PR interval, and if it is less than 3 small boxes, then it is short PR interval. So where we can see this prolonged PR interval, we can see in AV block. AV block means atrioventricular block, and we also can see in vagal stimulation. If we have vagal stimulation or we have AV block, we can see the prolonged PR interval. And where we can see shortened PR interval, obviously less than 120, where we can see it in sympathetic stimulation. In sympathetic stimulation. So we have to look at PR interval, then we can know if it is prolonged or if it is shorter. Now we will move on to the QT interval. So as all of you know, this is our P wave, Q wave, R, S, and T wave. So this is our Q and this is our T. So this interval is our QT interval. Okay. So this is our QT interval. So we have to see if QT interval is prolonged or shortened. So normal QT is half of RR interval, half of RR interval. So this is R, and then we will have our next R. So this RR intervals half. So this is our QT interval. This is our normal QT interval. If it is more than half of RR interval, then it is prolonged QT interval. If it is shorter than RR interval, half of RR interval, then it is shortened QT interval. So where we can see prolonged QT interval. Prolonged QT interval can be seen in hypocalcemia. And also we can see in hypocalcemia related disease like tetany, in which we will have numbness and spasm of our muscle. And wherever we can see prolonged QT interval, which is our use of anti-arrhythmic drugs. In which we will see the prolonged QT interval. So now, where we can see shorter QT interval, obviously it is our hypercalcemia. When we have hypercalcemia, we will have shorter QT interval. And because of the hypercalcemia, what we will have? Because of the hypercalcemia, we will have confusion and we will have constipation. This is general symptoms of hypercalcemia. So now we will move forward to most important segment, which is our ST segment, from which we will identify the arrhythmias. So fifth and most important is our ST segment. Okay, ST segment. So I will just draw the normal ECG. So this is our P wave, this is Q, R, S and T. This is our normal looking ECG. So in ST segment, as all of you know, that this is our S wave and this is our T wave. So this part right here, I will draw it with another pen. This part right here, which is our ST segment. Okay. So we have to look this ST segment. This ST segment can be elevated, can be depressed, and this T wave can be inverted. Okay, three things we have to look. This ST segment can be elevated, can be depressed, and this T wave can be inverted like this. This is our P, Q, R, S, and this is our T. So this wave, this is T inverted. Okay, this is T inverted. So what this inverted T wave represents? Inverted T wave represents ischemia in the heart. Ischemia in the heart. As I have told you in the previous video, we will also have this peak T wave. Peak T wave, what peak T wave represents? Hyperkalemia. And this also represents the ischemia in the heart. So inverted T wave and peak T wave both represent the ischemia in our heart, and more specifically, peak T wave represents hyperkalemia. So sometimes we also see like this. This is a P, this is a Q, R, S and flat like this. There is no T wave. There is no T wave. This means we are having hypokalemia. Or sometimes there is no T wave but we will see small bump here. This is our U wave. Like I have told you in the previous video, U wave represents hypokalemia. So now moving forward to ST segment elevation. ST segment elevation. So how ST segment elevation looks like? This is our P, Q, R and like this. This is our ST segment elevation. This is typical example of ST segment elevation. And another example, let me show you. This is our P, Q, R, like this, kind of like this. So this is our ST segment elevation. Let me draw it properly, like this. So P, Q, R, S and ST segment elevation. So this is also ST segment elevation, and this is also ST segment elevation. And this means that we are having MI, myocardial infarction. If we have to say more specifically, then MI in which muscle? MI in transmural. All layers of cardiac muscle. And sometimes we see ST segment depression. Look here. This is our P, Q, R and like this. This is our ST segment. This is typical example of ST segment depression. See, this part is depressed from the baseline. So this is the ST segment depression, and this is also means that we are having the MI, but in the endocardium. Okay, endocardium. It means that our ischemia has progressed from epicardium to endocardium, and this is more severe form. Because after endocardium you can rupture the wall of the heart. So you have to be quick when you see the depression in the ECGs. So another arrhythmias are of LBBs and RBBs, which are left bundle branch blocks and right bundle branch blocks. Like I have told you in the previous video that how to identify LBB and RBB from the axis. This is our normal axis, and beyond this is our left bundle branch block, and beyond this is our right bundle branch block. In the previous video, I have taught how to identify LBBs and RBBs more simpler way, so you can watch that video by clicking here. That method is really helpful in exam, so make sure you check it out. So moving forward to another arrhythmias are our ventricular tachycardias. VT, ventricular tachycardia. When you see ECG, you will understand this is ventricular tachycardia so easily. Ventricular tachycardia looks like this. This is our ventricular tachycardia. There is no rhythm, there is no P wave, there is no QRS, no T, nothing. This is our ventricular tachycardia. This is a typical example of ventricular tachycardia. And when this happens, you have to be really quick and start the CPR and do the shock treatment. Okay. So last but not least, which is our torsad points. Torsad points. So this is the most feared outcome of prolonged QT interval. This is the most feared outcome of prolonged QT interval. Okay. So this also is caused by hypokalemia, hypomagnesemia and hypocalcemia. Okay, these also can cause by hypokalemia, hypomagnesemia and hypocalcemia. And this rhythm looks like just ventricular tachycardia, but there is one difference, which is intensity. So when you will see the intensity is going down, then again up, and going down, then it is prolonging like this, then going down, prolonging like this. So you will see this pattern. Look at here. This is our torsad points. This is a typical example of torsad points. So you have to make the difference between these torsad points and ventricular tachycardia looking like this. There is no this swinging of impulse. There is straight lines like this. So this is ventricular tachycardia and this is our torsad points. So this is how you will identify different types of arrhythmia. In next video we are going to talk about the treatment of these arrhythmias. So if you have liked this video, then hit the like button and subscribe to this channel and share it with your all friends who needs to learn the arrhythmias. And I will see you next week in my next video with the treatment of arrhythmias.